Good morning, Mr. Patient. I'm Dr. Malinowski. Nice to meet you.
Dr. Malinowski, it's a pleasure to meet you. Actually, Norman L. and my friends just call me Normal, and you can call me that.
Normal patient.
Right.
All right, Norm, how can I help you today? What brings you here?
Well, I'm a little scared. I can't see very well out of my right eye. It's like a cloud, or it's a gauze pen. It's actually very difficult to explain, but it's like, I don't know if you've ever seen anything like it before. It's like branches or twigs or a big piece of dirt coming out. In fact, just so you understand what I say, I actually drew a picture for you that it looks like this is covering my eye.
Oh, that's fascinating. I don't think I've ever seen anything quite like this. So are you having any flashing lights?
A little bit, yes.
And what are they like? Are they in the center? Are they off to the side? Where do you see them?
I see them on the side occasionally.
Okay, and how many days ago did that start?
It's been about a few days.
Okay, are they getting any better?
No, it's staying about the same, but the fact that I can't see it just scares me. And I'm sure you've never seen anything like this before, but I hope you can help me.
Okay, anything going on in your left eye?
No, my left eye is perfect.
Okay, well, why don't we take a look and let's see what's going on.
Great.
Come on forward here in the machine and just put your chin on the cup and make sure your forehead's all the way up so I can see. And then just try to look straight ahead first, okay? And the light's really bright. I know your eyes are dilated, but just for a few seconds, I got to take a good look. Oh, wow. Who did your cataract surgery?
I don't know if you know him, Dr. Steve Shanebaum.
Dr. Shanebaum? Do I know him? He is the best cataract surgeon. He's phenomenal.
Oh, he did a great job. I could see so well now. It's really good.
Wow, he did a great job. Both of your lenses just look perfect. How did you end up at Dr. Shanebaum's?
Oh, Dr. Fill in the Blank.
Dr. Fill in the Blank? Oh, fabulous. She is the best optometrist, probably the best in all of southeastern Michigan.
Yeah, I thought she was fantastic too.
Oh, you're so lucky to have such two really good doctors. All right, let's keep looking now. All right, just look right over here at my ear and keep looking straight ahead. So what I'm seeing so far is that the gel that fills the eye, the vitreous gel, it's shrinking a little bit, and it's a normal change. It just happens. And keep looking straight. Okay, now go ahead and look way up high, and then look up and to the left. So I'm looking for any parts here that may have torn or detached. Sometimes when the gel is shrinking in the eye, you can get a tear or a detachment. Look to the left. I'm not seeing anything bad so far. Doing great. Keep looking down and left. I know it's really hard with these bright lights and the dilating drops. Keep looking straight down and down and to the right. And look way over to the right side. So I see that the gel inside of the eye has separated. I'm not seeing anything bad so far, but we need to look at you with another light. And with each of these lights, I see a different part of the eye. So go ahead and sit back, and then let's take a look with the next light. I'm going to give you a drop. Right here's a tissue so you can wipe your eye. Okay, go ahead and look up for me, and just one drop. Okay, go ahead and wipe that. And it's going to sting for a second. That's a little bit of anesthetic and just keeps you comfortable. And I'm going to lean you back. So this next part, I'm not going to hurt you at all, but you're going to feel me pressing a little bit on your eyelid. And you're just going to feel a little bit of pressure, but nothing bad. You doing okay?
I'm fine.
All right. And I won't hurt you at all. You're just going to feel me pressing real gently on your eyelid. And that drop that I gave you really helps. It keeps you real comfortable. All right, go ahead and look down like you want to see your left shoulder. And use the other eye too. It really helps. Just try to imagine you're looking down and to the left. Great. Look straight down towards your toes, right in the center. Good. And look down at your right shoulder. Okay, keep looking down and to the right. Excellent. Okay. And now look way over to the right side. Try to see your right ear. Keep looking that way. Fabulous. Good. And now look way up and to the right. Good. And up at the very, 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 very top of your head. Straight up as best as you can. Good. Keep using both eyes. You're doing great. Excellent. Look way up and to the left. Good. And straight over to the left side. And one more time down and to the left. And we're almost done. You did great. Excellent. That's really hard to do. Good job. All right, let me sit you up. So basically everything that I see in the eye is a normal change. You know, unfortunately, there's this thing called birthdays, and birthdays cause things to change in your body, and this is one of those things that happens. There's a gel that fills the eye, and during your whole life, it fills the eye much like Jell-O inside of a mold. But what happens is, you were nearsighted before your surgery with Dr. Shanebaum. You've had a few birthdays, and so the gel changes, and it just happens. But everything looks good. I don't see a tear. I don't see a detachment. And slowly, everything should just start to get better.
Well, did it happen because I was playing basketball?
No, it just happens because of birthdays and being nearsighted, and you were nearsighted before.
Well, I did go parachuting last year. Maybe that caused it.
No, as I've said before, this happens because you have too many birthday candles on your cake, and it happens.
No, I take really hot showers, and does that cause it?
I wish that were the reason, and people really don't like to hear it, that, unfortunately things change over time. It's just the way it is.
So if it's too many birthdays. So I should have been born on a leap year.
That's one idea. I can't say anyone's ever suggested that before.
Well,
Sure, why not?
What could I have done to avoid this? Because
Nothing. There's absolutely nothing you can do. A lot of people think this happens because of injuries, or they hear about Sugar Ray Leonard getting a detachment, but it just happens. You're sitting there, and it was programmed in your genes that it was supposed to happen, and it happened. But the good news is you really don't have anything today, and all of this should just get better on its own over a few weeks' time.
great.
Okay, so do you understand everything? Do you have any questions? Anything else I need to cover?
I understand. I have a symptomatic PVD without a vitreous hemorrhage, and therefore the risk of a tear or an RD is about 20%. And if I had a vitreous hemorrhage, my risk would probably double to 40%. Look, even though I've had excellent cataract surgery with Dr. Shanebaum, preoperatively I was between a -1 and a -3 myope, so I have a 4 times greater risk of a tear or an RD. In fact, if I'd been over a -3 myope, my risk would have been 10 times greater.
That's right.
Yeah, and in fact, I'll bet you want me to come back in a week or two because my risk of developing a tear is still about 5%.
Wow, that's amazing. You're very smart, and you're really a quick study.
Well, thanks. I just learned everything today from you.
Wow, I guess I really did a good job this time, didn't I, huh?
You did great.
Yeah. Well, like you said, I'll see you back in a week or two, and here's a booklet that talks about floaters and flashing lights, so that's your door prize. And take this form up to the ladies at the front desk. They'll give you an appointment for a week or two, and then just make sure you verify all of your insurance information.
Oh, insurance?
Yeah, you do have health insurance, don't you?
Honestly, no, I don't. But how about if I take you out with our son tonight for pizza?
Oh, another normal night.